It's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode, I shared another question in this series of questions from my client Veronica. And the question last week was part 11 of my 71-year-old dad is in intensive care with stage 4 lung cancer and stroke. He's on the ventilator now and in an induced coma. What are his chances of survival? You can check out last week's episode by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer the next question from my client Veronica, which are excerpts from one-on-one phone and email counseling and consulting sessions with me. And the question this week is part 12 of my 71-year-old dad is in ICU with stage 4 lung cancer and stroke. He's on the ventilator now and in an induced coma. What are his chances of survival? You can also find previous episodes from this one-on-one counseling and consulting sessions if you are clicking on the links below this video. And if you're watching this on YouTube, just click on the link below and you'll get to our website where you can access all the other episodes. So Veronica writes, "Hi Patrick. My father started getting midazolam and fentanyl since 2 p.m. this afternoon, and my dad is still with us. I hope this is normal. The intensive care doctors and nurses thought he would pass away a lot sooner. I do not want him to suffer. Do you have any advice or comments, please? I'm by his side at the moment and I can only text. I can't call. My father didn't get to communicate with us after he came out of his induced coma, as he was too weak to speak and to write. He was able to nod to respond though. My dad is a real fighter, but I hope he's not suffering. My dad was very distressed yesterday as he was coming out of the sedation, and he didn't want nurses near his neck where they were putting the sedatives. He refused morphine for pain, so we only had the fentanyl and the midazolam the doctors suggested to be administered. He's still with us. Is this okay? He is slowly letting go. It's after midnight now as I'm writing this. I hope and pray he's not in any pain." From Veronica. So here's my response. "Hi Veronica. Your dad is very lucky to have you by his side so you can be there for him in his final hours. Fentanyl and midazolam are fine in a situation like this. It really depends on how much they are giving. Have you got a dose? How much are they giving? Fentanyl is very similar to morphine, if not stronger, and should manage any pain if given in adequate doses. You see, Veronica, in a situation like this, it's a fine line between keeping your dad comfortable and pain-free and also not to euthanize him. I have mentioned my concerns about the issue of euthanasia before. Even though it is common practice to give midazolam and fentanyl or morphine in end-of-life situations, it is again a fine line between keeping a patient comfortable, minimize their suffering at the end of their life, without hastening death. Some people might argue that strong sedation like midazolam in high doses, as well as high doses of strong painkillers, also known as opiates, like fentanyl or morphine, might hasten death, especially when patients are not on life support. I tend to agree that it hastens death, as I have seen those situations hundreds of times after having worked in intensive care for over 15 years in 3 different countries, and where I've literally worked with thousands of critically ill patients and their families. Now, from my perspective, Veronica, if patients are in a real and not in a perceived end-of-life situation, I am supportive of this approach. Now, if you want to know what's the difference between a real and a perceived end-of-life situation, I wrote a blog and made a video about this. So check out the difference between real and perceived end-of-life situations when your loved one is critically ill in intensive care. Again, I put a link to this article and video below this video in the written version of this blog. I do have massive concerns, Veronica, about this approach if patients are in a perceived end-of-life situation, get taken off life support, and then get administered midazolam and fentanyl for end-of-life situations. That, in my mind, is euthanasia and is clearly hastening death if other options haven't been considered. In your dad's situation, I think we can confidently say that he's in a real end-of-life situation because we have left no stone unturned and there's nothing, unfortunately, that can save your dad. Also, if your dad was in pain, I am certain that you or the nurses could see it. A normal dose of fentanyl and midazolam in an end-of-life situation would be up to between 150 micrograms an hour of fentanyl and between 5 to 20 milligrams an hour of midazolam. In some rare situations, I have seen up to 300 micrograms an hour of fentanyl and up to 30 milligrams an hour of midazolam, plus the occasional fentanyl or midazolam bolus. Therefore, timeframes are really hard to predict. I can certainly jump on a quick call with you in the next half an hour if you would like to, as I've just come off the phone to another client, so we can do that. Either give me a call in the next 30 minutes or I can call you back if you prefer. My phone is always on if you have any questions or if you need reassurance later. So, before we look at Veronica's response to my email, if you're watching this and you want one-on-one counseling and consulting and advocacy with myself where I can help you to get the outcomes that you want for your critically ill loved one, go and have a look at one-on-one phone and email counseling and consulting at the top of the website. Click on the link and choose from the options that works best for you. So, here's Veronica's response. Hi Patrick, thank you for your reply. My dad is getting 50 micrograms an hour fentanyl and 5 milligrams an hour midazolam, and bolus doses of fentanyl in between as well. His blood pressure is dropping slowly, but all monitors were turned off in the room we are in hours ago, but they are monitoring him in another room. Thank you, from Veronica. So here is my response. Hi Veronica. This is a standard dose of fentanyl and a standard dose of midazolam for such a situation. Also, bolus doses of fentanyl and midazolam are fine too. Given that you mentioned your dad made noises yesterday and is not now, I think you can be fairly confident he's not in any pain. If you have concerns about pain, please talk to the doctors and the nurses. Fentanyl, though, is a very strong painkiller. I know this is a difficult situation for you, Veronica, especially being in the middle of the night and after so much you have been going through over the last few months to help your dad and also to help your mum and your brother to deal with this situation. One thing that I learned over the many years having worked in intensive care and having seen hundreds of patients die in intensive care is that no matter how hard and difficult it is to lose a loved one, it is okay when we die. It's part of life. I really don't want to sound cliché, but from my perspective, it's nothing we have to fear. I know it's easier said than done, but just by you being there will help your dad. And give yourself a pat on your back for being there for your dad and for being so strong. You are in a privileged situation to be with your dad in his final hours. Please let me know if you need anything and just give me a call. So, here is the response from Veronica. She says, thank you, Patrick. My strong dad took his last breath at 1:15 a.m. and his heart stopped at 1:36 a.m. He went peacefully. Thank you for your assistance and reassurance during this time. From Veronica and family. Hi Veronica, I'm very sorry to hear that your dad has passed away. It's good to hear that you were there for him in his final hours, and again, you should be very proud of yourself for being with your dad and supporting him and your family until the end. For now, I wish you and your family all the strength, compassion, and determination to deal with the loss of your father, and should you wish to follow up on the circumstances that led to your dad's passing, I would be very happy to debrief with you on this. We can also review medical records if you feel like this is of benefit for you and your family. It can often help to clarify exact circumstances and it helps with closure. I really appreciate you being a client and I enjoyed working with you and supporting you with this. Please do not hesitate to contact me if you need any other help. Thank you. So, how can you become the best advocate for your critically ill loved one? How can you make informed decisions, get peace of mind, control, power, and influence quickly once your loved one is critically ill in intensive care? You get to that all-important feeling of making informed decisions, get peace of mind, control, power, and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision-making fast once your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence in your situation. You will get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You will get crucial behind-the-scenes insight so that you know and understand what is really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also check out our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Or you can call me, find international phone numbers on the top of the website. Also, have a look at our ebook section for more ebooks, videos and audio recordings, and you can also get one-on-one counseling and consulting with me via Skype over the phone or via email by clicking on the tab on the top of the website. This is Patrick Hutzel from IntensiveCareHotline.com, and I'll see you again next week in another update.